Welcome to the Rogers Kakasungura YouTube channel. The government of the Republic of Kenya wants to set up an Ebola facility, or it's already setting up an Ebola facility when our doctors are receiving poor pay. What is the priority? Our doctors have announced a protest. Health is a devolved function. You want to prepare for Ebola, yet you do not have workers for that project. You want to tell us you've set 20 watt centers of Ebola isolation facilities, yet the people you want to use in those facilities are undergoing poor working conditions. The doctors from Isiolo County have a message to all of us, and this should be shared even to the White House so that the international community understands that Kenyan medical workers are suffering. We have a failed health insurance that doesn't work, that is crippled. We have a failed health system whereby we don't have even enough bed capacities. We don't have enough ICUs. We don't have enough oxygen containers. We do not have. The doctors themselves are crying. Up to an extent, they are announcing a strike. Yet, these are the people you want to use to fight Ebola, yet their own lives are miserable. Can we listen to what doctors are saying?
Isiolo residents, we are here today as KMPDU to officially launch the strike of Isiolo doctors. Tumechoka na county kutuzungusha na kutupea empty promises. We issued a strike notice 21 days ago, na hadi saa hii the county government of Isiolo has done nothing to address the issues raised in our strike notice. The strike notice will be shared, which everyone can have a look at. But tuko na issues na Isiolo County government, na leo asubuhi ndio they called us for a meeting, which we feel that did not go anywhere in resolving the issues that we have raised. First of all, the meeting was very short notice. Our national officials were not able to join us, but we are here with Isiolo doctors and branch officials to lodge the following complaints against Isiolo County government. So the first issue that we have is there is no redesignations and promotions in this government. We have doctors who have stagnated in the same job group for more than 10 years. And we have doctors who've been working tirelessly serving the residents of Isiolo County with no promotions and with nothing to show for the labor and for the work in which they do. And then another issue that we have with the county government of Isiolo is that they have a perpetual delay in payment of salaries. Doctors go up to 3 months without salaries. This is not right, and it is against labor laws. We have currently doctors have not been paid for the months of April and May. The salary that was last paid was done, was March salary was paid 1 week ago. This is just wrong, and doctors are tired of begging for money, and yet they are working. We also have Isiolo County government not remitting statutory deductions. SHA is not being remitted. Doctors don't have a medical cover. Third-party deductions kama zile za bank loans and premiums for insurance policies are not being remitted, and some have many months dating back to as far as June 2025 and others up to September 2025. So you find that doctors are not able to get health care, and yet they provide this same healthcare in the health facilities in Isiolo. We also have no medical cover for doctors in Isiolo County. The county has not negotiated any medical cover for the doctors that work here. They don't pay SHA premiums. So basically, doctors in Isiolo have to go out of pocket to pay for healthcare. And then we also have a severe shortage of doctors. The county referral hospital itself is covered by only 7 medical officers. This is the work of at least 50 doctors. So we are demanding that the county government of Isiolo has to employ medical officers and pharmacists and consultants as a matter of urgency. We also have payment of doctors who have been working on locum or contract basis. They need to be converted to PNP. The law itself says that if you work on contract basis for at least 6 months, then you deserve or you need to be converted to PNP. So Isiolo County government is taking advantage of doctors and employing them on endless meager contracts that have no end in sight. So we are demanding that any doctor working in Isiolo on locum or contract basis has to be converted to PNP. Finally, we also have a lot of intimidation by the county government, particularly by the Chief Officer Health Services, Dr. Mahamoud Abdikadir. He has ensured that no doctor will work in Isiolo County as a free doctor who will exercise their clinical judgment. The Chief Officer has decided he will not only be an administrator, but also a clinical officer, a medical officer, a pharmacist, and a dentist. If he wants to run the hospitals, we can leave them to him, but he should not intimidate doctors who are working in Isiolo County. And for this reason, we have downed our tools effective yesterday midnight. That is midnight ile inaamkia leo. We are off work. We are going to stay off work. And the more the intimidators, the more we are going to stick to our resolve that we will not go back to work until these issues are resolved. Isiolo doctors are not begging for the county government to give them what is rightfully theirs. We are stating and demanding that the Isiolo County government have to straighten out their acts, and they have to do what is right by labor laws and by their employees. And therefore, as KMPDU, we stand in total solidarity with the doctors who work in Isiolo County, and we have instructed them not to go back to work until these issues that we have mentioned are all addressed and resolved in totality. And for that reason, I'm going to ask the residents of Isiolo County to know that madaktari hawako kwa hospitali. Kama uko na mgonjwa hospitali, go pick your patient, mpeleke hospitali asik services kwa county zingine neighboring. Waende Laikipia, wasiende Meru sababu hata Meru tuko na strike, waende county zingine za karibu, maybe Tharaka Nithi, because in Meru County pia wako on strike for similar issues. Isiolo residents, tafadhalini msiache wagonjwa wenu wakae hospitalini kama wapati matibabu. Pick your patients, let them go to other counties or in private hospitals to seek services, because every doctor in Isiolo is currently not working. And therefore, I'm going to talk to the Isiolo County government and ask them, we are not asking for favors. You know what is rightfully yours. Bwana Governor, we have tried looking for you previously. You know that our National Secretary General has tried looking for the governor and having a meeting with him at least 3 times this year before we gave the strike notice. But the governor has been elusive and we have not been able to get hold of him. Kwa hivyo, Mr. Governor and the county executive ya Isiolo, we are asking you to do what is right. We are asking you to address doctors' issues. Otherwise, it is our patients and the community we serve who are going to suffer.
Dr. Dima Adan Oge. I am a branch official, Upper Eastern KPMDU, Upper Eastern branch official, and I'm talking on behalf of my KPMDU union. I'm also a gynecologist at Isiolo Hospital. I've been working in Isiolo Hospital for since 2013. Personally, I've been in the same job group for 3 gubernatorial terms. Counties have been taking us around, not promoting us. I'm actually 14 years in one job group. So I appeal to our county to hasten doctors' promotion and meet our minimum demands so that probably we can go back to work. But without that, I don't think our doctors are going to go back to work. Thank you very much.
Shockingly, your president cannot listen to this. The only priority he has found is selling the Laikipia airbase to the American government so that it can build an American Ebola isolation center. Tumewambia, there are more issues that we need to internally deal with. Already, tumetangaziwa kwamba El Nino inakuja. How prepared are we? To us, Ebola is not a threat, Kenyans. Hii maneno sisi haituhusu. Kenya tumechungwa na Mungu. We live by the grace of God. God bless you. See you in the next episode. Asanteni sana.